Well, Nairobi Governor Johnson Sakaja is facing a backlash following his recent appointments to the boards of Mama Lucy Kibaki and Mama Margaret Kenyatta hospitals. The storm centers on what critics describe as the entrenchment of political loyalists in a sector that demands specialized expertise. Leading this controversial pack, ODM grassroots mobilizer Calvin Okoth, alias Gaucho, and Benga Maestro Ken Maria. Gaucho has dismissed uproar over his lack of formal training and challenged his detractors to shift their gaze from his academic records to his eventual track record. NTV's Laban Shaban takes a closer look at this controversial selection.
The recent changes in Nairobi's public hospital boards have turned the city's healthcare management into what critics say is the frontier for high-stakes political rewards. These developments have triggered a divide in public opinion, with digital platforms becoming a battlefield between those demanding professional merit and those defending the inclusivity of the appointments. Take Calvin Okoth, widely known as Gaucho. His reputation was not built in the sterile halls of a clinic, but in the heat of political protest as a fierce defender of the ODM party and a loyalist to the Odinga family. His past is marked more by run-ins with the law than by hospital rounds, having faced multiple arrests in recent years, often linked to his involvement in anti-government protests and allegations of creating public disturbances. Beyond the political fire, questions persist regarding his suitability for a technical board at Mama Lucy Hospital. Okoth reportedly holds no background in medicine or public governance, and with reports suggesting he did not complete his formal schooling, his appointment forces a direct confrontation between political reward and the specialized demand of healthcare oversight.
Unajua iko kitu moja watu wamesahau ya kwamba kukuwa board member si lazima ukuwe daktari.
Then there is Kennedy Wambua Ngunze, the Benga star the country knows as Ken Maria. His transition from the stage to the boardroom of Mama Margaret Uhuru Hospital has shifted the conversation from his music to his credentials. It is an appointment that brings into sharp focus whether the fundamentals of popularity are being prioritized over the specialized expertise needed to run a level 5 institution. The same board now includes Triza Miroya, a woman whose influence was forged as a UDA grassroots youth mobilizer in Kibera. Her seat at the table further intensifies the scrutiny over the country's selection criteria. For Miroya, the leap from organizing political blocs to managing hospital policy is a move that critics say is a preference for party loyalty over professional track records. These changes, gazetted by Health County Executive Committee member Susan Silantoi, effectively dissolved all previous boards on April 16th. Under the 2023 Facilities Improvements Financing Act, the new appointees now hold the keys to Nairobi's health infrastructure for the next 3 years. The legal debate centers on two conflicting standards. On one hand, the Facilities Improvement Financing Act provides for community representation, allowing voices from the youth and local residents into the halls of power. Whether by design or default, this woman, seen here in a video circulating on social media, was unpicked by Governor Sakaja to serve at the Mama Lucy Kibaki Hospital.
Huyu ni Dr. Susan, ana makaratasi ya udaktari, lakini Sakaja alimpatia cheo ako Mama Lucy Hospital.
Mukiriona mnajua ni mama nani? Sakaja. Mkikuja kula Mama Lucy, mtanipata huko. Mkiwa na shinda, uliza Dr. Susan. Ndio maana niko hapo juu ya gavana wangu.
On the other hand, the Constitution's Chapter 6 serves as a rigid filter for all public appointments. It mandates a baseline of competence and suitability. The CEC for Health is yet to respond to our inquiries, seeking clarity on the specific criteria used to vet and appoint the new board members. Laban Shaban, NTV.